Welcome to the Aflac Cancer and Blood Disorder Center at Children's Healthcare of Atlanta, Eggleston campus. We are located on the fourth floor in Tower 1. Apheresis cell therapy collection facility is performed within the Aflac Cancer and Blood Disorder Center's outpatient clinic. Inpatient collection is done in the inpatient rooms of the BMT unit or the hematology oncology floor that is located on the third floor, Tower 2. We will now give you a tour of the outpatient apheresis facility. To maintain security and patient confidentiality, the apheresis suite is secured by a keypad lock system. All that wish to enter the apheresis suite who do not have this code are required to enter through the Aflac clinic. As you can see, we have an appropriate designated area for our stem cell collections. These patient rooms help identify one space, one donor, and one product. Separate rooms prevent contamination, improper labeling, mix-ups, as we do everything at the bedside for our patients. Confidentiality is ensured based on the room design and ability to close the door for privacy. As you can see, there is adequate lighting, ventilation, access to sinks, and also to restrooms. Adjacent to all our stem cell collection rooms, you will see that we do have a nurse's station. And adjacent to this nurse's station, we also have our storage closet, and we have an area that has an Omni cell where we can get all our supplies without having to enter other parts of the clinic. In the remainder of this apheresis tour, you will see how we access our physician workrooms, our pharmacy that is approximately 100 feet away from the apheresis suite doors. All medications for patients are stored in this room that requires badge access and also pharmacist review before administering any medications. There is proper inventory control that is in our Pyxis and also done by the pharmacist. You will see that our biohazard materials are in the waste disposal room here, also secured by a pin pad. There is a coat cart for proper emergency management, a clean linen cart to ensure cleanliness, and also another clean utility room for additional supplies that are not common during the apheresis collection but are accessed through a special code provided to the apheresis staff. Environmental conditions are controlled through thermometers in the room and being able to accurately depict the temperature through monitoring. Each room has thermostats to adjust temperatures and humidity as needed. In addition, our apheresis suites have negative pressure alarm systems that aid with proper isolation and the ability to prevent airborne contaminants. As shown earlier, we do have a code card that is of easy access and mobility within the Aflac clinic. Located in each of our rooms, we have an emergency equipment at the bedside, an emergency box, a code button, call button, and respiratory support. On the same floor as our suites, we do have a pediatric intensive care unit that supports our rapid response or code blue initiations. In order to ensure proper protection for our staff, PPE is located in each of our rooms. PPE is not worn outside of the room due to accessibility within the rooms and proper disposal areas. Also noted in the patient rooms are proper disposal of sharps and designated boxes. Information regarding and proper disposal of biohazard materials is located on a shared drive that is easily accessed by apheresis staff and also system-wide. Our storage rooms are temperature and humidity monitored. Supplies are on a first in, first out method and labeled to facilitate this process. Shelving is off the floor, and we do also have a quarantine storage area. Sprinkler systems are in the ceiling and directly away from collection kits and other critical supplies. The two machines we use for our procedures are the SpectraOpti and the Theracocelix. Calibration stickers on equipment for maintenance are performed on all equipment, including blood warmers. We do have a designated area and signage for our equipment that is out of service or for calibration. In addition, our facility provides emergency power through red outlets to ensure safety during outages. All staff training records are within the administration suite, where our coordinator resides. These records are secured by badge access for restricted staff. Within the apheresis suite, we have a cleaning and sanitation log that's filled out by our EBS staff. Documentation in this log shows how rooms are cleaned or changed to ensure that surface contamination remains controlled, monitored, and recorded. Labels, logs, worksheets, and forms are locked within our apheresis office. Media Lab is document control software used by apheresis to manage policies, procedures, and forms. Apheresis staff have access to the most current information available in Media Lab, even during internet downtime. Proper labeling of cellular therapy products ensures complete and accurate labeling of collection container and cellular products collected by the apheresis staff. Labeling conforms to regulations consistent with the AABB, FDA, and FACT. ISBT 128 unit numbers must be used in sequential order. In the event mislabeling were to occur, CHOA has an established organization-wide system for occurrence reporting. This process is utilized for any unusual problem, incident, or other situation that would cause undesirable impacts in patient care. Inventory management closely monitors supplies, reagents, labels, and equipment. When we obtain a requisition and delivery documents for incoming supplies, we then fill out the incoming supplies log, which will have us verify the product insert. If a new insert is identified, there is an additional form and process for filling out the package insert change log. Overall, this system ensures that critical supplies meet specified requirements, and apheresis ensures that the needs and expectations of procedures are met. Please be advised that the patient you will see in this mock collection process is not a real patient. In addition, the filming of this mock process occurred over the course of a few weeks. For reference, the collection date occurred on June 26, 2021. Apheresis performs an orientation for pediatric cellular therapy product collection. This ensures that donor patient or family members understand the collection process and knows the risks and benefits of the procedure. This orientation includes general collection information that is in the Optia packet, pre-collection instructions, and collection day instructions. Apheresis staff will then evaluate adequacy of peripheral veins and or central venous access devices of the donor and patient. In addition, we will evaluate the need for a blood prime for the apheresis machine, typically less than 25 kilograms. The legal guardian and the apheresis nurse must sign and date this document. A copy of collection day instructions are provided to the family with an apheresis phone number. Apheresis will then notify the BMT program staff after the completion of the collection orientation and if a blood prime is required for collection. Apheresis is responsible for filling out a patient note in the chart regarding that the collection orientation was completed.
Okay, I have Daisy Benson, date of birth 12/19/11, MRN 72, and PAR is 600000125.
Alright, I'm going to read back and confirm the patient's identity. I have Daisy Benson, date of birth is 12/19/2011, MRN is 72, HAR is 600000125. After reading back and confirming the 4 patient identifiers between 2 nurses, it is documented in the patient's flow sheet. Verification is done prior to the patient collection. Apheresis staff are responsible for initiating and completing the hematopoietic progenitor cell collection registration checklist to ensure all documents are completed. BMT MD will consult for stem cell collection and transplant and identify the donor's suitability and eligibility prior to performing the collection. Verification documents in the donor chart will include a patient face sheet with demographics, CVC operative report and placement verification, infectious disease markers that have been performed and resulted, orders that are date, time, and signed by physician, including an epic, consent that is completed with date, signature, donor, and witness, donor history questionnaire completed and reviewed by medical director, medical history physical exam completed with donor suitability, pre-collection lab results of an ABORH and CBC, summary of donor suitability, evaluation of risk of hemoglobinopathy prior to administration of mobilization regimen, and urgent medical need if applicable. Prior to any CMNC collection, we will ask the donor and or authorized guardian the following questions while having another member of the apheresis team witness. These questions can be if the patient has experienced any chest pain, shortness of breath, pain drainage at the catheter site, or a headache. We will then ask if they consent to donate cells, have been given the opportunity to ask questions, and to refuse the collection. Any outstanding concerns that they might have from these questions or anything that are outliers, we will address the BMT team or our physicians to have them further answer. Cleaning before and after every procedure includes surfaces and the touchscreen of the Spectra Optia system. This removes all traces of dirt, fluid while using our approved facility disinfectant wipes. Pre-collection, the optic is cleaned prior to setup, entering the patient room when moving from an uncontrolled to a controlled environment. Visible inspection of the machine electrical supply is done. If the machine has frayed or twisted power cords, it would be removed from service. Post-procedure cleaning is similar to pre-collection, including inspecting and cleaning the safe seal. Waste is disposed within a labeled red biohazard bag and disposed in an appropriate waste bin. Verification and cleaning logs are done prior to collection and ensuring the weekly, monthly, quarterly cleaning log is up to date. All cleaning logs are found on the back of the Spectra Optia. Apheresis staff is responsible for the maintenance and quality control of the Spectra Optia Seal Safe system. Efficiency and safety is ensured through cleaning the sealer head prior to the first use of day of collections and testing to confirm that the sealer makes an intact seal on collection tubing. Documentation of cleaning and quality control tested is then performed. On the day of collection and prior to starting, the temperature and humidity of the apheresis collection room must be checked, verified, and ranged, and recorded on the apheresis room temperature and humidity log. Storage rooms are monitored through Isonex central monitoring. It should be checked from the last printout date prior to any collection to ensure disposables are stored within an acceptable range. In addition, prior to the collection procedure, we will verify compliance and maintenance and calibration. We'll look at semi-annual PM perform stickers on the apheresis equipment and also on our Alaris pump and blood warmer. Collections can occur either when the patient is inpatient or outpatient based on their clinical condition. Apheresis nurses will move equipment to the patient bedside and return to Aflac Clinic after collection is complete. We use disposable single-use collection kits and accessory supplies brought from apheresis storage. We ensure collection product supplies are adequate and the expiration date of supplies has not exceeded. Supplies used are documented in the patient's flow sheet and identified with their lot number and expiration date. Apheresis staff will wash hands prior to touching any equipment and wear proper PPE if needed. Staff are then responsible for loading, priming, and testing the disposable set according to the Spectra Optia Apheresis CMNC Collection Procedure Guide. Staff will follow screen prompts with connecting and priming the tubing. Configuring the system will be done by entering the patient's current height, weight, total blood volume, and hematocrit. Overview of white blood cell count and platelet count is done prior to collection. Custom primes will be indicated by machine when 10 or 15% of the patient's total blood volume is within the disposable set. Blood warmer tubing will also be utilized for all stem cell procedures. IV calcium gluconate is attached to avoid any sudden decrease in the patient's ionized calcium level. Target run values will be added based on physician orders and also based on apheresis protocol. The ISBT DIN, which is unique to the patient or donor, is affixed to all cellular therapy documents that are indicated. Staff will affix a donor collection base label as applicable to the collection bag. For instance, this patient is an autologous donor who is stimulated. HPC apheresis is the base label that's applied. Biohazard tags confirm the infectious disease markers have been performed and confirmed within the last 30 days. The partially completed base label and biohazard tag is affixed to the container before the cellular product is collected. Then the apheresis nurse completing labels will ask another individual to verify these labels, documents, and the donor's chart. At the end of the run, the product base label will be completed with the collection time, volume of product, and volume of ACDA added. A visual inspection of the unit will happen with 2 staff members and the apheresis collection facility director. These 2 staff members will initial the base label after they're done verifying. The apheresis nurse performing the procedure and the apheresis collection facility medical director or designee supervises medical care of the donor patient undergoing the cellular therapy product collection. While managing the collection process, apheresis staff is responsible for monitoring and managing vital signs. Height, weight, and baseline vitals are collected at the beginning of the procedure and documented in the patient's chart. Vitals are monitored every 15 minutes after the start of the procedure. Vitals are then continued until 30 minutes post-procedure. Increase in vitals may be done if the patient is experiencing any symptoms of the risk that come with the collection procedure. During the procedure, the apheresis nurse will monitor ionized calcium through trained point-of-care testing on an iStat machine. Ionized calciums are drawn pre-collection, intermittently throughout the collection, and post-collection. In order to avoid a sudden decrease in the patient's ionized calcium level, IV calcium gluconate is ordered per the apheresis stem cell collection orders and apheresis protocol. Apheresis staff is responsible for monitoring signs and symptoms of hypocalcemia and intervening. Physicians are notified when citrate toxicities occur, treatment is paused, and interventions are required. Once the run target has been attained and the machine is ready for rinse back, or in the case of a blood prime, no rinse back is performed, We'll confirm that the stem cell collection bag is labeled with appropriate autologous or allogeneic product label prior to disconnection from the apheresis circuit. We will then follow prompts on the spectroptia, which includes clamping and sealing the line 3 times above the T connection to the collection bag before proceeding to rinse back. After the disconnection of the patient to the optia, we will ensure post-labs are drawn and flushing of the venous access per protocol. And then we add anticoagulant to the collection bag per the physician orders. In this case, we would add 10 mLs of ACDA to the collection bag. We would then record the final values that are on the spectroptia and place it in the patient chart. As shown previously, we complete labeling of cellular therapy products at the bedside after the completion of collection and then release the product to Cellular Therapies Laboratory. CTL is always on site prior to completion of collection of cellular therapy products with a cooler. In the event that CTL staff is not on site, apheresis staff are trained and competent in packing and transporting non-cryopreserved cellular therapy products. The distribution cellular product chain and custody log and labeling cellular therapy product collected in documents log is a shared responsibility between the apheresis staff and Cellular Therapies for ensuring products collected are packed and transported properly to the lab for processing and testing. Visual inspection is completed by 2 staff members to ensure product and document is acceptable for release, then staff will sign and date. CTL staff receiving the product will initial, date, and time the forms. Final review for another inspector can occur during or after the release of the product. Apheresis staff will provide CTL copies of apheresis cellular therapy product labeling log and completed chain of custody log. Apheresis staff will keep the original labeling and chain of custody log for record keeping. At the end of the procedure, the apheresis nurse will transfer care post-collection to BMT staff for them to review post-labs and contact the family after collection. Once BMT has contacted the family about collection results, a collections notification form of the amount of cells retrieved is sent to apheresis staff. It is also important that the apheresis team ensures that patient billing was performed for cellular therapy collection. Apheresis completes this collection with procedural notes from both the apheresis physician and nurses. These notes are found both in the donor chart and our EMR. After completion of all necessary steps, the collection facility director or designee signs and dates the physician review of donor-patient chart when the collection and counts are completed. After the completion of the self-collection, patient information and charting is stored behind a key-coded secure door. Only the apheresis team knows this code, and it is stored within a locked filing cabinet